everybody, I hope you are doing good. So we are actually starting a new series in which we will be discussing about high yield ECGs that you need to know for your exams in step 1. In these videos, I won't be teaching you a whole of the pathophysiology of the diseases. I will only be telling you some tricks that you need to know to diagnose the ECG. Okay, so yeah, before starting the video, kindly subscribe to the channel because it motivates me to make more of such videos. So let's get started. Okay, first trick. Before seeing anything else, just try to see the rhythm of the ECG. Okay, how do you see the rhythm? You just count the big boxes present between your QRS complexes. Okay. If I see here, I have like 1.7 boxes between this between first two QRS complexes. Then I have for like two big boxes, then for like 2.5, then 3, then 2.5. So yeah, the rhythm is highly irregular, right? The rhythm is irregular. And if you have irregular rhythm, just go for P wave. Okay, see what is happening with your P wave. Okay, if I see, oh, actually I cannot find any P wave. There's no P wave. Okay, and the rhythm is irregular. Oh, okay, I find some bizarre waves present between two QRS complexes. Okay, so I have a pretty good points to diagnose this ECG. What do I have? I have irregular rhythm, I have no P wave, and I have bizarre waves present between two QRS complexes. My diagnosis will be atrial fibrillation, obviously. Okay. What your examiner wants you to know regarding atrial fibrillation. Okay. If this is present in your exam, guys, if this thing is present in your exam question, that a person has a history of binge alcohol drinking last night or a few hours ago, just don't think of anything else. This is definitely atrial fibrillation. Okay, so this is trick 1, and this is very important point. Write this down somewhere. Okay, and just remember this for your entire life. Okay, so okay, what are the causes of atrial fibrillation? Age is the most important cause of atrial fibrillation. There are certain kind of age-related remodeling of atria that predispose a person to atrial fibrillation. Okay, then all of the diseases that produce atrial stretching, okay, like mitral stenosis, your hypertension, these things lead to your atrial fibrillation. Remember these things, okay? Remember all of these things. You need to remember binge alcohol drinking, mitral stenosis and hypertension, and age, okay? Then again, we know that ECG findings will be irregular rhythm. There will be no P waves present. Instead, there will be bizarre fibrillary waves present between two QRS complexes. Okay. Then they need you to know some pathophysiology as well. Okay. Okay. So when you have atrial fibrillation, your left atrium has the cause in it. Okay. What is the cause of atrial fibrillation? The area where your pulmonary veins are entered in your left atrium is the area of pulmonary veins is the area that is culprit to atrial fibrillation, okay? Because this area is generating some crazy amount of current that is leading to your atrial fibrillation. So you need to remember this. And then if they ask you what will be the treatment of atrial fibrillation, what will be the definite treatment, although medicines can help, but medicines are not the definitive treatment of atrial fibrillation. Okay, so if you want to treat this atrial fibrillation, you have to ablate this thing over here, because this thing is producing some crazy amount of current leading to atrial fibrillation. So ablate this thing. Okay, they like you to ask, they like you to know this, and they ask you this, that what will be the treatment of atrial fibrillation. Then you will tell them that ablation of area of pulmonary veins is the treatment. Okay, then one more important thing that I actually forgot to write here. The feared complication of atrial fibrillation is your thromboembolic events. Okay, remember this thing. Just trying to write it nicely. Okay. Okay. So you will have thromboembolic events as a feared complication of atrial fibrillation. And what kind of thromboembolic events? Okay, remember that there is no proper contraction of your atria, there is turbulent blood flow, there is stasis of blood flow in your atria, so the patient can have thrombus formation in your atria. Okay, and when this thrombi become emboli, they will cause stroke, okay, and other organ ischemia. Okay, so stroke is very important. Okay, you need to know this. Stroke, they like you to know stroke. If the person has atrial fibrillation, the person can develop stroke because of this thromboembolic event. Okay, so yeah, all of these things are very important, and you don't need to know anything else in atrial fibrillation. Okay, these points are enough for you. Best of luck.